Medicare for All legislation has been introduced in Congress that would extend Medicare coverage to all Americans and eliminate private health insurance. Would you vote for that legislation? Glenn Hurst, I'll start with you.
Well, I've been really clear on this on the campaign trail. I absolutely would vote for the Medicare for All Act. As a matter of fact, on day one, I would sign on as a co-sponsor for it. This act serves to provide health care and opportunities to every American in this nation. It's also a great tool for rural recovery. There's so many great things that come out of this act, providing care for those 85 million people who currently don't have care insurance or are underinsured. I think it's incredibly important to know that it is the only act that's on the table right now to address health care. That we can't be just putting Band-Aids on cannonball wounds. We can't be taking the Affordable Care Act and expanding it or adding a Medicare option to it. Those are not on the table. They don't work. Medicare for All is the solution.
Abby Finkenauer, would you vote for that legislation?
No, because what we need to do, we need to actually up Medicare reimbursement rates. If that is not done, we are going to have a problem in this state when it comes to who is getting access to health care. It is what I worked on while I was in Congress. But what I do support is upping those Medicare reimbursement rates and having a public option that folks can get into that's like Medicare, that they can have if they want it, but also, I mean, if they have negotiated their health care through their union, through their employer, and they like it, I'm not taking away anybody's health care from any Iowan or any American. We need to make sure that that is very clear, but that they have an option to actually be in, like Medicare, if they so choose, which, by the way, would add competition into the marketplace to bring down private insurance anyway.
Mike Franken, would you support existing Medicare for All legislation?
Well, so I wouldn't have this opportunity in life to be standing before you had it not been for the comprehensive health care that the military provides for our special needs daughter. So this opens doors for people. So I'm a big fan of this, and to really work on the pharmaceuticals as well. But so how to implement this? I agree with Abby that we should bump down to, say, Medicare for all who want it down to age 50, and then start on the bottom, perhaps from birth to, say, age 5, and narrow it down to ensure the Medicare process system has an opportunity to grow into itself. You can't just do it and execute it. It won't work. So it needs to be incremental, but I believe this is the future of America, and it'll make us all better.